Welcome to part two of cervical cancer. We're talking about causes, prevention,
And symptoms.
and symptoms. There
Yeah,
are symptoms.
there are some. There are some. It's a silent killer, but there are some.
With Nurse Linda, senior mobile Nurse Linda, and Dr. Charles. And if you have a cervix, you need to listen to this. If your wife has one, do the same thing. If your girlfriend has one, you're in luck. Check it out.
Absolutely. Take care of your loved one. Encourage them to watch this or get the proper screening. But we're going to talk first about some of the risk factors. What puts a woman more likely to get cervical cancer? Number one is smoking. Clear cut, no questions asked. Smoking changes all of the cells in your body. These are very thin cells.
You got a question?
Yes.
How do you get a cigarette near your cervix?
That is a very good question. But this is how far reaching the effects of cigarettes have in your body. It makes it to the cervix. It makes it everywhere. And because these cells lining the cervix are thin, they're fragile, smoking can affect and change them. And again, these changes don't occur quickly. They occur over many, many years. Even if you have a history of smoking, you're still at risk for cervical cancer. The other one is having a decreased immune system, and this includes anybody with an autoimmune disease, including HIV, AIDS, anything like that, because this is your body's ability to continue to clean these cells and keep them fresh. If you have an immune system problem, that can't happen. So that puts you at higher risk. Having many pregnancies puts you at higher risk. Having a first pregnancy at a very young age. And I think they consider young age under about the age of 17. Because what happens is your cervix, whenever you have a child, it stretches. And there's a
No.
little bit of damage that's done to the cells, and our bodies are made to heal this damage and go right back to where it's supposed to be. Well, it's like anything. If you keep repeatedly injuring a very sensitive area like that, you can do damage that can't always be repaired. Doesn't mean you can't choose to have many pregnancies, that you can't choose to have a child at a very young age. Just be aware that that puts you at higher risk, and continue to get the screening as recommended by your doctor. Having a family history. And this is not a strong family history like other cancers, breast cancer, ovarian cancer, but it is still a family history of cervical cancer. May put you at higher risk.
Genetic?
Yes. They're looking for, just like they've identified the gene for breast cancer, they're looking for the genetic component for cervical cancer as well. And probably the most prevalent problem with cervical cancer is what everybody knows as HPV. That's the human papilloma virus.
Isn't that what they want to give young girls in school?
Yes, this is a sexually transmitted disease. HPV is found in 99% of all cervical cancers. That's how prevalent this problem is. Now, not all HPVs, there's probably 100 different types of HPV out there. Not all of them cause cancer, but those that do um, obviously are a problem. HPV is the most common sexually transmitted disease in the United States right now. And most people who get HPV never know it. There are no symptoms associated with this. That's why it's such a problem. Not like other sexually transmitted diseases where you might have an odor, you might have drainage, you might have pain. You don't get that immediately with HPV. HPV sits dormant for many, many years, causing damage slowly. That's the issue with this. And for people who get the most common causes of the most common HPV viruses, they usually go away within 2 years, and you never even know you had it.
Okay, well,
It resolves itself.
penicillin cure this?
No, penicillin does not cure this.
Hmm.
This is a virus, not a bacteria. Antibiotics don't cure viruses.
That's why they're called antibiotics instead of antivirals.
Antivirals, right.
Okay.
Um,
Now, they want to give these to kids in the fifth and sixth grade?
yes, and their reason behind that is um, you want to get, it's a series of 3 shots, and you want to get all 3 shots in before the individual becomes sexually active. And females are becoming more sexually active at younger and younger ages.
Sixth grade.
Yes, it's scary. It's absolutely scary. So you usually want to get the girls between the ages of 11 and 12 up through about the age of 26. After that, they have no data that the injections are really going to be that effective. Um, and for boys, same thing, usually about the same age up through about the age of 21.
Boys need this too?
Boys get this too, yes. Yes. Mm-hmm. There are two types of injections out there, and one can be given to boys. It's recommended for boys. The two can be given to either one can be given to the young ladies.
Well, a good friend of mine of many years doesn't believe in giving injections and shots to his kids.
And a lot of people feel that way, but what people don't recognize is it's because of getting all of the vaccines that many diseases have been wiped out or are close to being wiped out. HPV is one of those if we get it started now. If not, it's going to go beyond what we can handle. And you're putting a lot of people at risk. Well, people say, well, my daughter is very committed. She's not going to be sexually active until she's married, which is fine. And there are many, many young people today choosing to do that. But what about the history of their partner? Have they taken the same vow of celibacy? Are they doing the same thing? In order to protect your child, and we're going to go into that in prevention a little bit, is know your partner, know their sexual history for many, many years. What have they been exposed to? Remember the old adage, when you have sex with someone, you're having sex with everyone they've had sex with, and then everyone that person has had sex with. So you're getting the potential is
That's enough
tremendous.
to turn you off thinking about that.
It is. It's scary. It is absolutely horrifying. The other people recommended to get this vaccine are those with HIV, and both gay and bisexual are recommended to get HPV. Again, preventing the spread of this, preventing the development of it. It has been well researched. They're still following it for any long-term effects, and that's what people are afraid of. Well, what are the long-term effects of this? It's like any vaccination, you don't know for 20, 30 years, and you have to weigh your concern against the risk of your child developing this disease once they get into their 30s or 40s.
This is a sexually transmitted disease.
HPV is a sexually transmitted disease, yes.
There's resistance in parents to give this to your kids,
Yes.
11 and 12 years old.
Yes,
Why?
there is. Because the long-term effects are not known. They know the immediate effects, that there's nothing other than pain at the injection site. Other than that, there's nothing. But what is it going to do to their body 15, 20, 30 years down the road? And if my child was young enough at this point, I think I would opt to give her the vaccine, both my children, and worry about the risks later. Some people are afraid of doing that. So I would rather protect what I know is a strong possibility, which is cervical cancer, and genital warts. One of the injections prevent genital warts as well, which is a very uncomfortable disease. If anyone has that, they understand it.
Google it, folks.
Yes, absolutely.
You need to do that. Well, that was part 2. What's part 3?
Part 3 is there's actually good news. How to check for it, how to screen for it, things
Is
like
there
that.
a cure for it?
There is not a cure for it. Well, there's a cure for the cancer, and that's what we're going to talk about is the cervical cancer, not the HPV. Okay,
folks, we'll be right back with Nurse Linda on Brook Healthcare's program, Senior Moment with Nurse Linda. Ta-da. And don't go away. We'll be right back.